Welcome to NICC's College and Career Connection Fun Fridays from the Field Career Chats. We are so happy to be featuring a career that a lot of students seem to be interested in today. So thank you for joining us. We're going to talk about ultrasound tech with Brooke. So Brooke, I'm going to let you take it away. Tell us a little bit about yourself. And then I think she's going to give us a little tour because she is currently in a room with all the equipment and things you probably all want to see. So we're going to let her go ahead and do that.
Yeah, hi guys. My name is Brooke. I'm from Southern Iowa. I've been so like the professional terms like a sonographer. Uh, and then like ultrasound technologist is what you usually familiar with. I've done this for about almost 8 years. And I actually live in Southern Iowa. So about a year ago, I became a traveling sonographer. So now I'm here in Dubuque. So I drive home every week and then come here on Mondays. But I love the job, and yeah, if you want, and I can explain going through school. So I went to Mercy College of Health Sciences in about 2014, and it's about a little over almost 20-month program, an accredited program. Prior to that, I went to DMAC for about 2 years school to get my prerequisites as well for the program. So basically, you're getting your anatomy, physiology, chemistry, physics, your English compositions, psychology, all those prerequisite classes you need for the program, as well as other classes that you'll have to take that aren't just ultrasound related, and you can take prior to the actual program. After that, when I did graduate, I started working in Des Moines at Unity Point Health, which is a level 1 trauma center. We covered about three different campuses, and we all rotated. So getting that experience was really good because we did almost everything ultrasound related except cardiac, which is another program. So if you're truly interested in ultrasound, you can go a couple different avenues. What I do is called general OBGYN. I've also learned how to do vascular training on the job. One thing I don't know how to do is cardiac because I would have to probably go back to school. So then before you get into programs, you need to figure out, okay, do I want to do OB or in general ultrasound, or do I want to do cardiac? So then after I started at Unity Point, I worked there for about 4 years. And then I went to another hospital and learned a couple other different things as well. I did a lot more OB. And then I also worked part-time at an outpatient clinic. So I got all that experience before I moved on to being a traveling sonographer. So now that I've had that experience, it's a little bit easier to talk about. So then, so I can show you guys the room and then kind of go into more of what all ultrasound entails. So pretty much this is just our room. We have our little machine right there, and there's all different types of machine. There's no patients or anything on this, but there's all different kinds of machines that that hospitals and clinics will have. This is called a Philips. Luckily, I've been able to learn all different types of there's Canon, GE, Philips, Toshiba. Getting that knowledge of how to work these things is key to your job. If you can't scan, then you can't do your job. Other than that, we just usually have we do a lot of procedures, which when I started ultrasound school, I didn't really know. We do all sorts of biopsies. We can go into surgery cases. So it's really interesting in that, like, there's so much more ultrasound than scanning babies all day long. So yeah, there's just so much more diversity to ultrasound than what people think. And it's a lot more fun. But so that's pretty much the room. I mean, you just got a scan, a bed, and a bathroom usually, and we pretty private area. So then, are there questions that you guys want to, or Gita, was there kind of questions too that you wanted to focus on as
Yes,
well?
I have a whole list of questions. And a lot of the things you said, I think we should dive a little bit more into because they relate to the questions on the student worksheet if they're doing that. But please put your questions in the chat and we will make sure to get to those. So I'm really intrigued about the different environments. Yes, you're in the hospital, or maybe you're in an outpatient clinic as well.
Yep.
But one of our questions relates to the working environment. But you could be in this room or you could be in surgery, it sounds like. Do you want to talk about the different places you might be?
Yeah. So if you're working in a hospital, first off, you have your level 1 trauma centers, level 2s, you have your, and then level 3 hospitals. It just depends on how many departments they have. So as working in a hospital, we have to do portables to the ER, we go to the ICU, we go to all the floors of inpatients, we bring them down here, we go to surgery. So it's not just you're confined to one area. We're needed throughout the whole hospital. The outpatients, usually you have your room, you get your patient in the waiting room, and you typically have more of a 9 to 5 job. When you work in a hospital, our hours are random, crazy. We have call, but typically you make more money working at a hospital rather than outpatient. So there's the pros and cons as well. And you get typically, I really urge people coming out of school to work at a hospital to get better experience. Especially the bigger the hospital, you're going to get more of an exposure. Yeah. So.
Well, and another one of our questions, which you cover a lot of already, are the different kinds of career opportunities. So for you, we've talked about hospital, outpatient. You're a traveling sonographer. I didn't even know that was, I should have known that was an option because I've heard of traveling nurses. But do you want to tell us a little bit more about that or any other opportunities, for different types of careers once you're in the sonography field?
Right. So yeah, other than all those types of hospitals, there's so many types of outpatient clinics, from OB to procedures, fertility clinics. Traveling sonography is pretty much all of those, but you travel to the job site. Pros and cons of that: you typically make more money because you're sacrificing being home. But a lot of people do it too for the experience, or to go to states that they would like to see. I'm married, so I like to stay in the Midwest. And I actually fell in love with Dubuque, so they're always wanting me back, and I love it here. So then there's also like a mobile traveling. People go around to different towns or homes and do sonography in this mobile, kind of like the hearing places that go to high schools. I know a lady that opened up she bought an ultrasound machine and started doing like the fun ultrasounds for OB 3D at her house. Usually you need a lot of experience to do that, to open up something like that. But there's more opportunities than what people think. You can get into administration, you can be, get into that kind of things, or management. So yeah.
Wow. You're really helping us understand, I think, the breadth of the career, because I think a lot of people think, oh, ultrasounds, like pregnancy, babies, but there's so much more than that. And you said it's a separate certification if you want to do cardiac, like more education.
Yep. So when you go to school, you have to pass a physics board. That was my least favorite. We have a year of physics school, and then you during your ultrasound program, and then you have to go and pass a board on physics, which I thought was very hard. But once you get it done, then you're good. But then I had to go and pass an OB board, which is separate, and an abdomen board. Hopefully next year, I know how to do vascular now, but I would like to go get another board of vascular. But for cardiac, I would need like hourly training to go get my cardiac board, probably.
And the more, I'm guessing it makes you more versatile, the more of those certifications and exams that you pass.
Yes, I really do love that I don't want to say bounced around, but gathered training and skills by not just staying in one job. Is another perk of that is you can negotiate more pay. because a lot of the times places they'll only give you a certain amount of increase in pay. So it's kind of a way you can climb the ladder almost, per se.
All right. So we've talked about how you started at DMACC, you went on. So I think we've covered the education well, but if anyone has more questions, please let us know. What did you take in high school, or did you know in high school this is what you wanted to do? So did you kind of take some classes that maybe prepared you to go into the education pieces of this field?
So I knew I wanted to be in healthcare. I thought I wanted to be a nurse. So I got my CNA license and I didn't like it. I knew I wanted to be in healthcare still. I just didn't like a lot of the aspects of nursing. So I thought I wanted to be a dental hygienist, but I didn't want to wait 2-3 years to get in the program that at the time at DMACC. So I actually became pretty sick when I was like 20 and I had to get an ultrasound done. And I thought it was really incredible that they was like, oh, I didn't even know they did this other than babies. And so I kind of went down the rabbit hole after that and found someone that was in the program already, picked her brain, and then signed up. To get into school is extremely competitive because there's, I think, 3 places in Iowa that offer it, and usually only 8 a year, 6 to 8 a year. So if you think about it, this whole hospital we're in right now, there's only 2 or 3 of us a day compared to hundreds of nurses. So there's not a need compared to nursing. So grades are important, as well as they interview a couple of interviews to get into programs. My biggest advice on that is do not go in there saying you want to scan babies. They won't let you get. You have to do your get some knowledge of the thing and why you really do want to be in there, other than just scanning babies all day long.
So maybe some work-based learning as you get into high school to really see all the components of the field, learn more about it, read about it, talk to people who do that career,
Yes.
to help you really get into one of those spots since it's so limited.
Because they don't appreciate when people get in and then drop out. It's like a big wake-up call.
And none of our employers appreciate that either, because they're losing potential employees when those programs aren't full. Which is one of the reasons that we got into doing this session today, because we're understanding there's really a need for your skill set, Brooke, and what you do.
I agree.
Yeah. Okay. So how about you have lots of technical skills and healthcare knowledge. What kind of employability skills do you need to be in this field? You're interacting with different people all the time, it sounds like. So what would you recommend that students really need to be aware of for those employability skills if they're considering a career as a sonographer?
That's actually a really good question that I've never been asked. Going into it, especially when I was a little bit younger, actually took 2 years off before I went back to school. So I was a little bit older, and gathered some, more people skills, social skills, talking to patients. I've had trained students that can't even talk to patients. They're not going to succeed because we're one-on-one with people and we do personal exams. We see and we do, someone might lose their baby. Like it's very, you have to be empathetic, as well as you have to talk to some physicians that aren't very nice. There's obviously physicians that are nice, but working in healthcare, you have to have tough skin. But also, it's at the end of the day, you get to go home, if that makes sense. It's a job. So gathering social skills, being able to talk to people, as well as being okay with criticism and learning more things. Like I'm still learning. It's been almost 8 years. Like I'm always open to new ideas. So that's a good way to be, progressing in your career as well.
Any career, lifelong learning is so important. All right, you have some really cool slides to show us, but there's 2 more things we have to hit. So I'm not going to talk anymore. I want you to tell us your favorite things about the job, any parts you don't like, and then maybe we can dive into those slides that you sent us, because I think students will find those really fascinating. So we'll do that next. Thanks, Brooke.
Perfect. And wait, what was your last the question then? Sorry.
Things you like and don't.
Things like, okay. What I like the technology of it and being able to not diagnose, but like see the pathology, see the things first. It's kind of like you're the eyes of the radiologist. We send in the pictures that we personally have to find. So if we can't find, say, the cancer in someone's liver, they won't see it. And that could be a misdiagnosis. So we have a pretty important role in doing all of this as well. My least favorite, yeah, I mean, it can be hard when you have those really difficult cases that are really traumatic for people. Hours can be can be very brutal. The first job I got called in one time 5 times in the middle of the night. I pretty much was driving back and forth all night. My neighbors probably thought I was crazy. And then also just people can be really mean. You know, there's a lot of grumpy people out there, but you just have to, you know what, go with the flow. You're gonna get grumpy people everywhere. So just having that tough exterior again is important.
And remember, they probably don't feel well or they're scared about what they're going through. So a little bit of empathy, I'm guessing, would be.
And I make grumpy people too, as in like people that work like in places as well.
Oh, good point.
Getting all from, you just have to just go with the flow.
Absolutely. Those communication skills are critical. All right. Stephanie is sharing our slideshow here. If you want to talk us through these a little bit, Brooke.
Yeah. And then how much time do I have so I can kind of get an idea of that? Okay. Well, did you hear me? Sorry.
Maybe about 3 minutes.
Per slide?
No. Total.
Okay, perfect. So
maybe pick some of your favorites.
Yep, no, we can go really quick. So this is a normal fetus. That's a normal baby. We measure it. You can, and then do I click? Oh, there you go. So this is it. It says right ovary. That's a normal ovary to the right. To the left, that little brighter area that's like a circle, that's called a teratoma and a dermoid. So that's a mass that can happen in women, their, uterine area. This is a thyroid. In the bottom picture where people are measuring, or those darker, those are like a goiter. Those are masses that people can get in. They can be cancerous or benign in your thyroid or people's. The black thing is a gallbladder, and that shiny thing that has a shadow below it, that's a big gallstone. Ouch. We see those a lot. So this whole thing is a liver, and those arrows are pointing at cancerous masses in the liver, which is metastasized most likely to the liver, and that is usually terminal. This is the scary one that we had at the first slide in the beginning, but this is called anencephaly. It's one thing I've only seen one time, is when the cranium and the brain do not form totally there's no skull in the baby's head. And so we catch that, we call it the frog sign, because the head looks like a frog. But this is also, there's no chance of survival. So that's a pretty sad case. This is called torsion. These are testicles. The left one has blood flow, or the right one does, and the left one does not. And that's a pretty serious life-threatening thing that we find often. This one, so that's a left ovary. To the right of it, that other circle, that's called an ectopic, which also is life-threatening. We see these quite often. We're the ones that catch those on pregnant women. If we don't catch it, it can erupt, and then they can bleed internally and die. This is called spina bifida. Actually, my cousin has had a baby twice with it, and it's really unfortunate. But that's when the spine or the cord can come out of the spine, and we can catch that on ultrasound. The last one, this is a kidney and a big old kidney stone, and those are very painful. I've never had one, but oh my gosh, people screaming when we do them. So yeah.
And it is not your job to tell these people what their condition is, correct? You're just taking the photos and passing them on to another healthcare professional.
Exactly. After a while, I've become more comfortable. Usually I will tell people if there's no heartbeat or not. So, but yeah, those are the pictures. Those are just the tip of the iceberg. We do hundreds of types of pathology as well, and we need to know what they are as
That's really interesting to see the variety of just in what you showed us, because that was all good information for our students and certainly new for me as well. So we appreciate that.
Yeah.
Questions. So Jefferson is saying that they have a lot of students interested in the nursing field. But I think it's interesting how that's where you were thinking and you ended up in a different field, but still in healthcare. And I think that's really important for everyone to realize, you know, you can really be passionate about healthcare. And just because you get into one area and you're like, this isn't for me, there's a lot of different ones that you can still go into and try that might be a good fit.
Yes, job shadow. Go in there and see.
Absolutely. Is Marie there? Does she want to talk about the job shadow process a little bit, just so we have that captured?
Absolutely. So as Brooke said, it's really important, in middle school and then those early high school years to really do kind of that background research about a career and then really do your planning with your counselors. You really want to get classes heavy in the STEM area, those sciences, math, and also I'm a background as an occupational therapist. So also those psychology, some of those people type classes that really talk about interactions with people, because there's both sides, right? We have the science side, but we also have the communication and people side of things. So really doing your research about the career, where are schools, how long does it take to get that degree, what are the certifications, where can you work with that degree or that certification? And then we really tend to do more job shadows like junior and senior year. So once someone has really done the background, really learned about the career, read about it, learned schools, all that kind of stuff, has started taking the classes, background in science classes, that type of thing. And then we tend to do the job shadows, oftentimes a lot in junior year, where they come and they shadow for usually like in this area, half a day or up to a day. And sometimes we'll do someone's interested in nursing and ultrasound. So in the morning, we'll have them with ultrasound, and then in the afternoon, we'll have them with nursing. So we can set up a couple different areas. We do have a link on, if you go to your internet browser and Google MercyOne Dubuque, you can pull us up, and then at the top of the page when it comes up, there's a careers link at the top. And then when you get to that page on the left-hand side, there's an observation request link. And people can click on that, fill out the form, let us know where they want to observe. So,
thank you for sharing that. That's great information. And so many thank yous for offering that opportunity to students, because it's so important to have those actual experiences in the career before you spend the time and the money realizing then it's not for you. So if you can get that up front before you make that commitment, I think that's really important. So we appreciate you as a partner who's offering that opportunity.
Absolutely. We're glad to coordinate and work with you all.
Well, we appreciate both of you. Thank you, Brooke, for sharing your expertise. And also Marie for the information about how to connect with Mercy. That is fantastic. And yeah, this is probably one of our sessions we have the most students on live for in a long time. So thank you for that. And hopefully it will generate more interest in this career so you can fill all those positions coming up into the future.
Absolutely. Yep, we love it. Thank you so much.
All right, everyone have a great day. And thank you for joining this career chat with Northeast Iowa Community College's College and Career Connection.